To perform the active straight leg raise when you're considering wondering the ability of the sacro-iliac joint to transfer load, you ask the patient, I often do it passively first and say, this is called a passive straight leg raise. Any problem with that? No? Great. And any problem with this one? Super. This time I would like you to do that. What I will be watching for is any excessive bracing, twisting in the pelvis, because really all I'm asking him to do is to flex his hip. So that's all that should happen. I also want him to pay attention to if there's any difference between his right leg and his left leg, whether there's pain reproduction, whether one leg feels heavier, or if there's more resistance, or if they both feel exactly the same. So Greg, can you lift your left leg up in the air? And back down again. And that looked pretty boring. Now compare that, lift up your right leg, see if it, and you can see he twists in his spine, there's some bracing going on in his abs, and I asked him, okay, did they feel the same when you went to lift them up?
The right was harder.
The right was more difficult. So now I'm going to add a little bit of compression to your pelvis, and you tell me if, I'm going to repeat the right one, and you tell me if it's better, worse, or exactly the same. General compression of the pelvis. I'm going to take my hands to the outsides of his iliac crest, pec squeeze, and ask him again to lift that right leg. And down again. Does that feel better, worse, or exactly the same?
Better.
Feels better. Diane Lee suggests that you might be able to differentiate a little bit where the stability issue is. If you press at the greater trochanters, you are simulating compression at the symphysis pubis. So find the greater trochanters, squeeze there, lift up. How did that compare to when I squeezed and put it back down again? How does that compare to when I pushed on the pelvis? Better, worse, same?
Same.
This time I'm going to push more at the ASISs, mimicking the action of transversus abdominis, pulling together. And lift, and back down. Better, worse, same?
Better.
A little better. This time I'm going to take the heels of my hands and find the PSISs in the back of his pelvis. This will mimic multifidus's function. So I'll get you to lift up a little here, find the left PSIS, lift up here, find the right PSIS, squeeze those two PSISs together, and again, lift up the leg, put it back down again, and better, worse, same.
Same.
The same as the general one.
Yes.
And that's how you perform the active straight leg raise.